Assalamu alaikum students. Today we are going to discuss about the regulation of water balance and alterations in isotonic fluid volume. Let's discuss first about the body water balance. The total body water in our bodies, it varies with the sex and water. In young adult males it is about 60% of the body weight. In young adult females it is about 50% of the body weight, and it decreases with age. In old age, which is due to less fat and less muscles, and in infants normally have more the total body water than older children or adults. Infants have more than half of their total body water in ECF compartment. What are the gains and losses? The main source of water gain is through oral intake and metabolism of nutrients. Water, including that obtained from liquids and solid foods, is absorbed from the GI tract. Tube feedings and parenteral administered fluids are also a source of weight gain and certain metabolic processes. Normally, the largest loss of water occurs through the kidneys, lesser amount occurs through the skin, lungs, and the GIT tract. Uh, this is called the insensible water loss. What is obligatory urine output? The urine output required to eliminate these wastes is called obligatory urine output. It is usually between 300 to 500. What is the mechanism of regulation? Major regulation which the sodium and water depends upon it is the effective arterial blood volume or the effective circulatory volume. This is the vascular bed that perfuses the body. A low arterial volume activates feedback mechanism which causes an increase in renal sodium and water retention, and high effective circulatory volume triggers feedback mechanism causing decrease in sodium and water retention. It is monitored by stretch receptors in the vascular system which affect their effect through ADH and sympathetic system, and those in the kidney exert the effect through sympathetic nervous system and renin angiotensin aldosterone system. It is the as we discussed earlier that ECF is monitored by sensors called baroreceptors. The receptors activity regulate the water elimination by modulating sympathetic nervous system and ADH. Additional mechanism is renal sodium excretion in ANP, which is released from the cells of the atria of the heart, causing increase in sodium excretion by the kidney, and the renin angiotensin aldosterone system. And pressure sensitive receptors in the kidney are in the efferent arterioles, particularly respond to changes in arterial pressure through stimulation of the central nervous system and release of renin with the activation of RAS. Thirst and antidiuretic hormone and body water and serum osmolarity are regulated by thirst, which controls the water intake, and ADH control urine concentration in the renal output. This is primarily a regulator of water intake and ADH regulator of water output. The mechanism which contribute to the regulation of body water and indirectly to the regulation of sodium are thirst and ADH. The reabsorption of water by the kidney is regulated by ADH, also known as vasopressin. It is synthesized by cells, as you can see in the diagram, in the supraoptic and paraventricular nuclei of the hypothalamus, and then transported along a neural pathway, that is hypothalamo-hypophyseal tract, to the posterior pituitary gland where it is stored. When the supraoptic and paraventricular nuclei in the hypothalamus are stimulated by increased serum osmolarity or other factors, nerve impulses travel down the hypothalamo-hypophyseal tract to the posterior pituitary gland, causing the stored ADH to be released into the circulation. As with thirst, ADH levels are controlled by ECF volume and osmolarity. Osmoreceptors in the hypothalamus are capable of detecting fluctuation in ECF osmolarity and can stimulate the production and release of ADH. Let's discuss some disorders of thirst. Hypodyspnea means decreased ability to sense thirst, commonly associated with lesion in areas of hypothalamus. Example like in head trauma, meningiomas occur in subarachnoid hemorrhage. Polydipsia means excessive thirst, which is normal when it accompanies condition of water deficit. The types are true thirst or sympathetic, inappropriate or false thirst, compulsive water decree, also called psychogenic polydipsia. Now, the disorders of the sodium and water imbalance are divided into two categories: isotonic contraction of expansion of ECF volume and hypotonic dilution hyponatremia or hypertonic concentration hyponatremia of extracellular sodium brought about by changes in extracellular fluid. The isotonic, let's discuss about the isotonic fluid volume deficit. The fluid volume deficit is characterized by decrease in the ECF, including the circulating blood volume. The etiology and clinical manifestations. The isotonic fluid volume deficit results when water and electrolyte balance are lost in the isotonic proportions. What are the causes? Causes are inadequate fluid intake, excessive GI fluid losses, excessive renal losses, and excessive skin losses, and other third space losses are also there. Now there are certain manifestations, like as you can see in the chart, like for inadequate fluid intake, the manifestations can be acute weight loss, ranging from mild to moderate to severe, and in excessive skin losses there can be decrease in the extracellular fluid volume, depressed frontinel, or sunken eyes, or soft eyeballs. What is the diagnosis and treatment? Is based on history of conditions that predispose to the loss, certain weight losses, and observations of certain physiological functions which are indicated of decreased fluid volume. Certain intake and output measurements afford a means for assessing fluid volumes. However, these measurements may not represent actual loss, largely because of accurate measurement of intake is often difficult. So measurement of heart and blood pressure provide useful information about vascular volume. Test. Measurement of heart rate and blood pressure provides useful information about vascular volume, but a simple test to determine the venous refill time is compressing the distal end of a vein on the dorsal aspect of the hand, where it is not in the dependent position. The vein is then emptied by milking the blood towards the heart. The vein should refill almost immediately when the occluding finger is removed. In case of decreased venous volume, as occurs in fluid facet, venous refill time increases. Capillary refill time is also increased. Capillary refill time can be assessed by applying pressure to a fingernail for 5 seconds and then releasing it and observing the noting the time, normally from 1 to 10 seconds it takes for the color to return to normal. Now the treatment is correcting the fluid loss by fluid replacement and measures to correct the underlying cause. Usually the isotonic electrolyte solutions are used for fluid replacement. Isotonic fluid volume excess are characterized by fluid volume excess representing an isotonic expansion of the extracellular fluid compartment with increase in both interstitial and vascular volumes. What is the etiology and the causes? Isotonic fluid volume excess almost always result from an increase in the total body sodium and accompanied by increase in body water, although it can also occur as a result of excessive sodium intake, mostly caused by decrease in sodium and water elimination by the kidney. What are the causes? Inadequate sodium, as you can see in the chart, inadequate sodium and water elimination, excessive sodium intake and relation to output, and excessive fluid intake in relation to output. And for each of the cause, there is the clinical manifestations given, which you can see in the diagram. And the diagnosis of fluid is based on the history of factors that predispose to sodium and water retention, weight gain, and manifestations such as edema and cardiovascular symptoms are indicated of expanded ECF volume. Treatment of fluid volume excess focus providing a more favorable balance between the sodium and water intake and output, and a sodium restricted diet prescribed, and a diuretic therapy given to increase the sodium elimination. When there is need for IV fluid administration or transfusion of blood, the procedure required careful monitoring to prevent fluid overload. Now, there are certain disorders of ADH we will which occurs due to abnormal synthesis and release of ADH, like in number of stressful conditions or in pain, trauma, nausea, and use of drugs like alcohol, nicotine. Two important disorders that alter ADH level are diabetes insipidus and inappropriate secretion of ADH. Thank you.